Good morning. I'm Dr. Rebecca, and this morning I'm going to be showing you some exercises that you can do both during pregnancy to help with having a faster labor and to keep your body strong to prevent back pain. And then I'm also going to be showing you some good postpartum exercises that you can start doing immediately postpartum to help rebuild your core and to prepare your body for carrying your baby around and nursing. So the first exercise that every pregnant woman should be doing is called deep belly breathing. So for deep belly breathing, you can do either sitting or you can do standing. I'm going to show you sitting because I feel like it's easier to feel the muscle contraction that you need to feel in this exercise. So that's what we're going to start with today. So the muscle that we're working on activating is called your transverse abdominis muscle. And the thing about this muscle is it starts in your back and it wraps all the way around to the front and it attaches in the front here. So this muscle is what is important for preventing the condition called diastasis recti, which is where these muscles in the front will actually split open and then you get this gaping after pregnancy. This muscle activation is going to help prevent that. And it's going to help for effective pushing because your transverse abdominis muscle is what's important for compressing and pushing your baby out. So this muscle looks like a big corset that goes around your waist and it adds for core stability. So the way you do this exercise, you're going to do a deep belly breath in. So you're going to feel your belly push out as you inhale. And then when you go to exhale, you're going to feel your belly draw in. And what you're going to feel for as you exhale is you're going to feel for your sides out here to get tight. You're going to feel this muscle push out against your fingers. So as you continue to exhale, you'll feel these muscles get tight. After you're done exhaling, you're going to hold this tension that you feel for about 10 to 20 seconds and then relax. You're going to do this about 10 reps and do that at least twice a day, if not more, to help really activate this muscle. Now, the second exercise that almost every pregnant woman should be doing, and I say almost, is because it's not good for if your baby is currently breech, and that exercise are basic squats. So the way to do a good squat, and the reason why you want to do this in pregnancy is because for labor, you might spend a lot of time in a squatting position because squatting helps open up your hips during labor, and it has for good balance as your body changes and as you carry more weight in the front. It's good to have good glute strength, and it's good to have good leg strength. So the way to do a good squat, and I'll show you from the side, you're going to stick your butt back and you're going to keep your knees behind your toes. You're going to keep your shins relatively perpendicular to the floor. So when you go to squat down, you're going to stick your butt back and come up and stick your butt back again and come up. Nice and slow and controlled. So you're not trying to go really low. You're just going to feel for that good contraction in your glute and in your quads. I prefer to do at least 20 repetitions of that, 5 sets of those a day. If you want to go for more, that's great too. The third exercise, we're going to move more to the upper body. So, as you know, with your triceps, these muscles here, you use these a lot to push yourself up from a chair. You use them to push yourself out of bed. It's also a good exercise to think about doing now or postpartum if you happen to have a C-section, because the more you can push yourself out of the bed or out of the chair, it's going to help take a lot of stress off of your incision area. So for a tricep dip, you're going to take a chair, and you're not going to be sitting in the chair. You're going to put your hands on the chair like this, and you're going to dip back, nice and slow and controlled. Again, don't worry about going down really low. You can go down to about 90 degrees. You don't have to. you might start to feel some tension in the shoulders. So if you start to feel that, just go down a little bit less, okay? So you want to do this for about 10 to 12 reps and do 3 sets of that a day if you can. The last exercise that I'm going to show you is called 4-point kneeling. And this exercise, I'm going to show you on the floor here. This exercise is good for labor. It's a good position to help open up your hips during labor. So you're going to be on all fours like this. And what you're going to do is you're going to rock back slowly to where your butt will actually sit on your heels and come back up again and rock back and come back up. And you're going to do about 10 to 15 reps, 2 sets of this a day. What this does, it helps strengthen your shoulders. So your shoulders, you might need to be able to hold your body weight in this position a lot during labor, and it helps to open up your hips and get your hips strong as well, because that's important for delivery as well. So let's say you've done these exercises and now you're postpartum and you had a great delivery, and now you want to work on rebuilding your core and getting your back strong again. And these are going to be really basic functional exercises, nothing crazy, so you can do a lot of these immediately postpartum. The first exercise that I would recommend to do again when you're postpartum is the deep belly breathing that we talked about with pregnancy. So for deep belly breathing, remember, you're going to inhale and your belly is going to come out, and then you're going to exhale, your belly's going to draw in, and you're going to feel for your sides to get tight. You can do these immediately postpartum to help tighten up your core again and get things stable so you don't injure yourself, because your body is weak at that time and your ligaments are really flexible, so it's going to help protect your back. Same thing, you're going to do the deep belly breathing a couple of times a day, do about 10 repetitions of that. The second exercise that I'd recommend doing postpartum are pelvic tilts. So for pelvic tilts, you're going to be on the floor and you're going to lay with your legs bent, and you should be able to put a hand under the small of your back. Now what you want to do is you want to flatten your back against the floor like this. So you're going to roll your pelvis up towards your shoulders, and you're going to hold that position for 10 to 20 seconds. And relax that. Say you held it for another 10 to 20 seconds. And relax that. Do that 3 times and do 2 sets of that. So the next exercise that I think is really important for every person who is postpartum is push-ups. So we're not going to be doing push-ups where you have your legs straight like this. You're going to be doing modified push-ups. So you're going to be on your knees, or you can also do these against the wall. If you do them against the wall, the further you put your legs closer to the wall, the easier it is. So you can really modify how much weight you're pushing if you do it against the wall, but I'll show you on the floor. You're going to have your knees on the floor, and you're going to be going down nice and slow and controlled. Do it really slow. The slower you go, the more it actually challenges your muscle. So you want to do about 10 reps, 3 sets of this. This is going to help you carry your baby. It's going to help with nursing. It's going to help to maintain good posture because you spend a lot of time hunched over and doing this position. So the last exercise that I want to talk about, going back to the 4-point kneeling position that we did earlier, is an exercise that is going to strengthen your back in this position. So the way that you can strengthen your back, and you can do this exercise, you can do most of these exercises almost immediately after you deliver, as long as you're not sore. So let's say 1 to 2 weeks postpartum, so that you can start getting your body ready for your regular workout routines. In this 4-point kneeling position, you're going to take turns with extending your leg out like this and holding that. Take your other leg, hold that out, and you're going to feel the contraction back here in your muscles. You can do just one arm out like this. You can do the other arm, or you can do both at the same time. You want to mix up what positions you do, and you want to hold these, you want to vary the positions for about 30 seconds. So just continuous motion like this for 30 seconds, okay? And do 3 sets of that per day. That's going to help strengthen your back, because you just spent 9 months carrying weight in the front here, and it's deconditioned your spine, so this will help protect your back so you don't have back problems after pregnancy as well. If you have any questions, feel free to type those in the comment box below, and thank you for joining us, and I hope that helps you have a good pregnancy, a great delivery, and also a great recovery. Thank you.